gets better when you're 40, it gets easier 50, train bus train because it's got washed out. The train trucks have been washed out. It's working. Other than that.
Hello, everyone. I'm Laura Erskine. I'm the director of the UCLA Center for Healthcare Management. I'm also faculty in the School of Public Health. And on behalf of the UCLA Center for Healthcare Management and the UCLA Fielding School of Public Health, I want to thank you for joining us. Both those of you who are here in person and the about 40, 50 people who are watching online. Before we begin tonight's session, I want to thank the many donors who make this program possible. And we are deeply, deeply grateful for their support. As many of you know, this program is named in honor of Paul Torrens, who is now Professor Emeritus at the Fielding School. For more than 40 years, Paul Torrens has guided and mentored and advised students at our school, helping many shape distinguished careers in public health. You'll see them all throughout Los Angeles and all across the country. A few housekeeping notes before we begin. We encourage questions from the audience, and so there will be time towards the end of the presentations for those questions. There are also QR codes throughout the presentation that link to the panelists' bios, so I'm not going to read those in detail for you. Gun violence is a leading cause of premature death in the United States. Guns kill more than 38,000 people and cause nearly 85,000 injuries each year, equating to 100 deaths and 230 injuries every day. The scale and complexity of the challenge cannot be overstated. A public health approach could be a key way to address different aspects by strengthening civic organizations, maintaining pressure on elected officials, advancing research on gun violence, and addressing aspects of prevention. We are honored to have with us this evening 4 distinguished experts. Ninez Ponce, who is the director of the Center for Health Policy Research and the chair of the Health Policy and Management Department at UCLA. Kelly Fisher, who's the deputy director of the Office of Violence Prevention at the LA County Department of Public Health. Joshua Stepikoff, who's a board member at Women Against Gun Violence. And Brian Malte, the executive director of the Hope and Heal Fund. It's my pleasure to get tonight's program started by welcoming Ninez Ponce. Ninez, welcome. We're delighted to have you with us. You can either use the arrows or you can use the mouse on the...
I see. Thank you so much, Dr. Erskine, Laura. I can use, let's see, that's enough for me. Good evening. I'm Ninez Ponce, and as Laura said, I'm the director of the UCLA Center for Health Policy Research and professor and chair of the Department of Health Policy and Management at the Fielding School of Public Health. I'm so delighted to be here today to represent the department and the center and to, of course, promote. You can't hear me? How about now? Did you hear I'm Ninez Ponce? Okay, yeah. I think maybe let's go try this way. Let's try this way. Yeah, I'll have to adjust here. I'm not a gun violence prevention research expert, but I do run a big survey called the California Health Interview Survey, and that's what I will be discussing this evening. Let me start by saying that gun violence is a public health issue Absolutely. That's why a lot of you are here. And it's a crisis that too many of us, unfortunately, are familiar with. Gun violence is the leading cause of premature death in the United States, as Dr. Erskine said. I also would like to recognize that Joshua Stepikoff is here with us today, who was wounded in 1999 along with 4 other people at the North Valley Jewish Community Center by a white supremacist active shooter on that same day, went on and shot and killed Joseph Ileto, a Filipino postal worker because he looked Asian or Latino and worked for the government. It is a painful part of our history and as we celebrate Filipino American History Month and observe Yom Kippur. So I wanted to thank Joshua for being here with us today. So today we'll be sharing the latest findings on gun violence. From the California Health Interview Survey, it's the nation's largest health survey, and it provides population representative estimates of the California population on a range of health topics, as you can see here, on mental health, oral health, access and use of health care, health insurance, employment, and many behaviors. I wanted to also acknowledge our funder for the CHIS gun violence module. It was supported by an award from the National Collaborative on Gun Violence Research through a grant through the Arnold Foundation and administered by the RAND Corporation. I also wanted to acknowledge that in this research team, we have renowned researchers in the gun violence prevention space, Joan Asternow, Marion Betts, Emmy Betts from Colorado, Kareth Conran from the Williams Institute here at UCLA, Michael Rodriguez, who's now at Public Health Institute, George Tita, and our CHPR staff, Todd Hughes, Royce Park, AJ Scheitler, Sean Tan. So I want to say that for more details regarding the findings from the CHIS gun violence module, we do have a fact sheet. The fact sheet was released when the 2021 CHIS data was released. And so I invite you to read our CHIS health policy fact sheet. It is available at the center's website. Please follow us on social media and sign up for our e-blast for more developments or to learn about developments on this gun violence research that we're doing at the center. So here's talk about the results now. Sorry, this is a little bit awkward with, okay. Well, gun violence is often associated with mass killings. It is homicides, suicides, and attempted suicides that account for the majority of gun-related deaths and injuries in the United States. Nearly 71% of gun deaths were homicides, about 21% were suicides, and 8% were unintentional firearms-related accidents. And these are the statistics, not just in the US, but globally. However, the US posts the highest rates of gun homicide, gun suicide, and accidental gun death. The death rates from guns is number 2 after Brazil, but it's one of the highest in the world. For this reason, our findings look into gun ownership at home, gun safety issue, and attitudes regarding gun violence for key population groups who were recently or disproportionately affected by gun violence. These groups that we focus on are young adults, veterans, the LGBTQ population, and immigrants. So this CHIS gun violence module was asked of adolescents. So we started with adolescents ages 12 to 17, as well as adults 18 and over. So according to the 2021 CHIS, 17.6%, or more than 1 in 6 adults in California, live with a gun at home. And this slide shows the distribution of the proportions across these different groups that we focused on: young adults, immigrants, veterans, lesbian, gay, or bisexual, transgender or gender nonconforming, and adults living in rural areas. Across our key population groups, the proportion of veterans who reported living with a gun at home was twice the proportion of all California adults. And 38.1% versus 17.6%. Sorry, this is not the, let me just go here. Go back to here. Adults in rural areas also had almost twice the proportion who live with a gun at home compared to the proportion of all California adults, as well as the proportion of adults who live in urban areas reporting having a gun at home. So higher rates among adults living in rural areas. US-born adults had 3 times the proportion of having a firearm at home compared to immigrants. And we also found that 14.8% of young adults reported having a gun at home. 13.8% of lesbian, gay, or bisexual adults reported having a gun at home. Similarly, 13.2% transgender adults reported having a gun at home. And this is important because there may be some other surveys that ask about gun ownership, but not on specific demographic, racial, ethnic groups, specific looking at sexual orientation, gender identity groups. So I think that this is one of the important pieces of the new insights from the California Health Interview Survey. Plus, we survey over 20,000 households each year. We sample by county or county strata so that we're able to look at different patterns geographically. We also geocode, so you can geocode to local jurisdictions on if there are any specific policies or social culture, social norms that then are part of trying to understand the factors that get at gun ownership, and as you'll see later on practices on gun safety. So on firearm storage and safety, among California gun owners, nearly 3 in 4 used a cable-locked or locked container. 1 in 13 used both a trigger lock and a cable-locked or locked container. And, but 1 in 5 used a trigger lock. I'll talk more about that, how safe that is. And 1 in 13 reported having a firearm at home, but that firearm was loaded and was unlocked. So gun safety experts suggest that the use of only a trigger lock may not be sufficient in creating a safe environment, as guns with a trigger lock can still be accessible to those who may not be permitted to access one, particularly children and adolescents. Further elaborating on gun safety, we found that 1 in 7, or 13.9% of veterans, kept a firearm at home that was loaded and unlocked, which is twice the percentage of non-veteran adults in California. The percentage of immigrant gun owners who kept a firearm loaded and unlocked was significantly lower compared to non-immigrants, for those who are US-born. And for LGBT adults, 9.3% kept a firearm loaded and unlocked, but it wasn't very different, statistically different from non-LGBT individuals. So Chis also asked how concerned California adults were about being a victim of gun violence. The level of concern was measured as a scale from not at all worried, not too worried, somewhat worried, and very worried. In this presentation, we provide estimates of adults who are very worried about being victim of gun violence. So our analysis indicated that 1 in 8, or 12.9%, of California adults reported they were very worried about being a victim of gun violence. And this varies by different population groups, by different segments of the population. We have immigrants who are 3 times more than the average US-born adults that say that they're very worried. And we also see that, that adults in rural areas are less likely to be worried than adults living in urban areas. Same with veterans, less likely than non-veterans. But we do see higher proportions among young adults and LGBT adults of being very worried of being a victim of gun violence. So I think that's just, I hope that that's given some view of what's happening in California. In some, about 5.2 million adults, or 17.6, kept a firearm at home. And California veterans comprise the highest percentage of those with a firearm in the home. And also that of all Californians, 12.9% were very worried, and with higher proportions among the immigrant populations, young adults, and the LGBT populations of being very worried. So how this report card relates to family, neighborhood, and local policy factors, and whether there are associations with health, mental health, and well-being have to be explored to take on a public health perspective. We are continuing the discussion on this very important and timely topic through the 2022 E.R. Brown Symposium, which will be held virtually on Monday, December 12th from 10 a.m. to 2 p.m. I hope you can join us then. The symposium is called Policies for Prevention Addressing Gun Violence as a Public Health Crisis, with opening remarks from California Attorney General Rob Bonta. He will be followed by 2 panels of experts presenting the evidence for success in addressing gun violence and exploring examples of successful programs and policies that we can bring here to our neighborhoods, to our counties, to our state of California. So I thank Dr. Erskine for the opportunity to present here, and apologies for the wonkiness of trying to go back, but I hope you heard what I said, and I look forward to the discussion.
Inez, thank you so much. Before I introduce our next panelist, I want to apologize for the running around. We're having some difficulties with the live stream. So you guys are all fine. Everything's going great here. I'm delighted to announce our next panelist, Kelly Fisher. Kelly, thanks for being here tonight. You can either use the mouse on that arrow or you can use the arrow right here.
Thank you. Good evening. Thank you, Dr. Erskine. It's an honor to be here amongst all these panelists. My name is Kelly Fisher. I work with the LA County Office of Violence Prevention in the Department of Public Health. I'm going to talk a little bit about our approach for a public health approach to violence prevention and many of the initiatives that we have. First, I want to give space for some trauma-informed practice and just to recognize that this is an incredibly difficult conversation that impacts many of us in many ways. Survivors of violence, those who work with survivors and have been impacted by this issue personally through their work or personal lives, and to honor the need for self-care. This is my only data slide. There's a lot we could share, but I wanted to give a big picture of what violence and homicide and suicide look like in LA County. This trend slide shows all homicides, not just those that are related to guns, and suicides from 2011 through 2020. Previously, it used to be that in LA County, we were the opposite of national trends. Nationally, typically suicide rates are higher than homicide rates. That flipped around 2008, and we're starting to see after the pandemic that is starting to flip again as homicides increase. In public health, we look at social determinants and the root causes for the issues that we're seeing, and this is the same with violence prevention. And we know that social determinants and the context in which people live has a great deal to do with how they're able to thrive and whether that they are safe. And it's important to look at how violence intersects with many different health and social issues, and often disproportionately impacts the same individuals and often our communities of color. This is a quote from Dr. Deborah Prothrow-Stith. Gang violence is connected to bullying, is connected to school violence, is connected to intimate partner violence, is connected to child abuse, is connected to elder abuse. It's all connected. The types of violence throughout the lifespan are interconnected, and our job as public health professionals is to figure out how we build systems and policies and programs to support the prevention of violence. In 2019, the LA County Board of Supervisors established the Office of Violence Prevention within the Department of Public Health, and it's relatively rare for these kinds of offices to be within public health. This office is charged with strengthening collaboration across the county's various violence prevention initiatives across multiple forms of violence. We have a governance structure that includes a multi-sector group of our county partners, but also a table of survivors and experts in violence from around the county to guide our work. We are fortunate to report that we now have ongoing funding. This was just confirmed in October through Measure B, which funds our trauma hospital system in recognition of the need to prevent violence. A public health approach to violence is very complex. I see in blue, there are many of the common things we think about in a public health approach. Looking at the socio-ecological model, looking at data to drive our decisions, a focus on population health, reducing risk factors and increasing protective factors. But I think what we've learned from the public health approach to violence prevention from our advocacy partners is that there needs to be much more. We need to be comprehensive. Even though public health typically focuses on prevention, we need to be responsive to the immediacy of violence, intervention and postvention, as well as the systems that may cause harm and perpetuate harm. We also have a critical role in building collaboration across community and institutional and service partners to address these issues. And I would say most importantly that we engage those who are most impacted by violence in driving the solutions and implementing the solutions. These are the 6 implementation priorities of our countywide office. We have established regional violence prevention coalitions in each of the service planning areas across the county to help guide this work. We are working on creating an open data portal that's accessible to the community to help inform efforts. We have expanded the Trauma Prevention Initiative, which is our community-driven safety program, which I'll talk about in a minute. Crisis response, having a community-driven response. We have a pilot in South Los Angeles, and I'll share a bit about that as well. Healing-centered and trauma-informed systems change to undergird all of the efforts of our office and our partners, and shifting the narrative about violence and trauma. The Trauma Prevention Initiative is a community-driven public safety approach that we've built with our community partners that invest in peer strategies such as street outreach and hospital violence intervention, putting the power in the hands of community and grassroots organizations to address violence. We've been able to implement this in 4 communities of South Los Angeles since 2016, and as of early this year, have expanded to 9 communities across the county. New crisis response initiatives. We're building a community-driven response to multiple forms of violence. The first is the Care and Response Team pilot for South Los Angeles, where we will mobilize peer outreach workers to help individuals and communities heal post-violent incidents. And this may be homicide, it could be suicide, mass shootings or deputy-involved shootings, or hate crimes that have been plaguing communities. We also have a new program called the Family Assistance Program, where we'll be providing peer healing support and burial cost assistance to people who have lost a loved one due to law enforcement. Throughout all of our work, we really recognize that community leadership and lived experience matters. This is a photo of 2 of our intervention workers that we've partnered with for many years in South Los Angeles, and one of the champions that we've been able to find in law enforcement. If we want these initiatives to be successful, we have to involve community in driving those and make sure that they have the trust of community, they're able to advocate and give context to the data that we often see and understand what the true impact is and what the solutions may be. And it's important that they play a leadership role in deciding how funds are allocated and how programs are implemented. Trauma-informed systems change is a strategy we're working with many of our county partners to improve how systems serve community members to ensure that we do no harm. And this includes training and communication strategies, learning collaboratives, and technical assistance. We were fortunate early this year to get COVID recovery funding from the federal government, $25 million to help fund Many of the strategies mentioned here, as well as at-promise youth programs and flexible funding for community members. Shifting the narrative, the Storytelling Project. This is a project we just launched last month. We have a book posted on our website that has stories from more than 100 survivors of violence all across the county that talks about the circumstances of violence and pathways to healing. Last, I'd like to mention a platform to address gun violence and look at more policy solutions that we've been working with our partners on. We have 39 strategies. Our priorities right now are looking at robust gun safety legislation, increasing many of the intervention and healing programs that we've mentioned before, improving enforcement of domestic violence restraining orders and gun violence restraining orders, and increasing access to comprehensive, culturally relevant physical and mental health services for school-age youth. Thank you. I look forward to the discussion.
Kelly, thank you so much. Our next panelist is Joshua Stepikoff. Joshua, thank you for coming.
There we go. Is that better? Cool. Great. Yeah, a Photoshop picture of yourself is not a good thing to stand in front of. I'm going to bring the mood down for a minute, but then I'm going to try and bring it back up. I have a little bit of a different approach to the public health crisis of gun violence, as was mentioned a little bit earlier this evening. My name is Josh. On the morning of August 10th, 1999, so over 20 years ago, I was attending the North Valley Jewish Community Center in Granada Hills, California, when a armed neo-Nazi came in with an Uzi knockoff. He fired 70 rounds in less than a minute. He shot myself twice, 2 other kids under the age of 6, a camp counselor at the age of 16, and a receptionist in her 60s. And he later that day went to Chatsworth, California, where he murdered a mail carrier just because he didn't like the color of his skin, but he was working for the government. So for me, taking a look at this issue as a public health issue is not necessarily looking at the numbers, which although they are important and they help tell a picture or they help tell a story, but for me, this issue as a public health issue is taking a look at the public. Who does this affect? How long does it affect them? What is in store for them for the rest of their lives? So ever since that day in August of 1999, I've been involved with the gun violence prevention movement. My parents immediately got involved, and then a little bit later in my life, when I wasn't a little 6-year-old, I was given the opportunity to speak, to share my story, and to let people know exactly what that experience looks like as you're going through it. I'm brutally honest. I'm very open about what it is that I've experienced. And I feel that that is the one and only thing that we can do or that I can do as a survivor of gun violence to truly make people understand what it is that we're subjecting everyone to by not treating this as the epidemic that it is. So for me, it's been 20 plus years of dealing with post-traumatic stress disorder. It's been dealing with every different type of therapy you can imagine, from medication to yoga to, it's called eye movement desensitization reprocessing. And some of these were state-funded therapy sessions, and some of them were privately funded therapy sessions, right? But ultimately, at the end of the day, it was something that cost myself a lot of money. It cost the taxpayers a lot of money. So from the public health perspective, in that sense, this is a gigantic epidemic that does cost. I remember hearing, I think like probably 7 or 8 years ago, it cost close to $1,000 a year. Brian, you'll hit on that later. You can correct me if I'm wrong. Close to $1,000 a year of taxpayer money per taxpayer just to deal with the epidemic of gun violence. So I'm going to keep it short at this part, and I'll leave a lot of it up to the Q&A, but that's my story. I now happily married. I have 2 beautiful daughters. Don't ask me about them because I'll start crying, especially on this stage. I was born and raised in the San Fernando Valley, and that's where I continue to live and raise my family. I have a undergraduate degree in psychology with an emphasis in marriage and family therapy. And then I went on to get my master's degree from Pepperdine University in clinical psychology with an emphasis in marriage and family therapy. So I then completely did a 180 and do something else with my life at this point. But I have the background, I have the knowledge, and I understand what it takes not only to move forward from a mass shooting or from any shooting in general, but I also understand what that healing process looks like from the other side of the room, what it means to sit in that chair as a therapist and to take on the burden of what some of these survivors are going through, but also to craft treatment methods that are effective in treating something that the everyday citizen should not experience ever in their lifetime, but due to, as the numbers show, an extremely high number of firearms amongst our population, it's kind of inevitable that this is going to happen and continue to happen. So I look forward to the panel discussion, and I'm going to hand it back.
Josh, thank you so much for sharing your story. Our final panelist, I want to welcome Brian to the stage. Do you want to use this microphone or do you want to use this?
Oh, sorry.
Okay.
I'm going to bend over a little bit as I'm a tall person, so hopefully you all can hear me okay. I have a loud voice, so hopefully that'll help. First, I want to recognize Josh, as I think I always have in my career. Thank you for sharing your story. And as someone who hasn't suffered that kind of trauma, I try to walk in your shoes a little bit, and you guys keep me, all the victims of gun violence, keep me motivated all throughout my career. So thank you for that. We'll talk a little bit about solutions tonight and just an overview. We can get into it more into discussion. But before we do that, a little bit about Hope and Heal Fund. Hope and Heal Fund is now a 6-year-old fund, and it's a collaborative fund made up of over 20 foundations here in California, California Wellness Foundation, California Endowment, Blue Shield, Cedar Sinai, et cetera. So very proud to have such a collaborative group of folks with us. But before I get a little bit more about Hope and Heal Fund, I spent over 20 years with the Brady organization, and a lot of it on Capitol Hill, and a lot about federal gun laws and state gun laws. Very proud of my work, but I have to say, I'm much more proud. Oh, yeah. Much more proud of the work that we're doing now, because it is, as I say to a lot of folks, I'm in the gun violence prevention movement, but it feels like a different movement when you're dealing with community and you're dealing with intersectionality and public health. So it's been a really rewarding 6 years. So again, Hope and Heal, we're a collaborative fund. I didn't have the wherewithal to set it up. Foundations here in California helped set up the Hope and Heal Fund. Now we have, again, over 20 and now some national funders, and we have over 40 individual donors. And at the forefront of everything that we do, we are a race equity fund. And what does that mean, right? People throw out race equity. We were equitable, especially after the murder of George Floyd. You hear a lot about that. But we are truly walk and talk race equity. And what does that mean? And I think you've heard some folks allude to this is, as folks say in communities, don't talk about us without us, right? So you need to have folks who are highly impacted and most impacted by gun violence at the table. And one of the things that has certainly happened, I can attest to this working with the Brady organization, I know things are changing on the national front, is now we are actually getting people to the table. We're actually talking to the people in communities most impacted. Those folks, if you're talking about passing background checks at the federal level, whether you're talking about assault weapon ban. There was no one talked to those communities most impacted. They were made in boardrooms. So that's what I love about this job is we actually go deep, deep, deep into communities. We talk to the folks that are most impacted. We don't tell them what to do. We showcase best strategies, best effective strategies that are working locally around the state and around the country. We expose them to the strategies. They get to choose what they want to do. Our only ask of them is that they get on the same page, right? Because one of the issues with philanthropy is that philanthropy, whether intentional or unintentional, puts out a grant, an RFP for a grant, and unintentionally or intentionally, you're making community-based organizations compete against each other for that funding, as opposed to getting them on the same page. So when we're talking about solutions, the idea is invest the time to get the folks together. And it's not just your police chief, it's not just your mayor or city council members, it's the folks on the ground, sometimes who aren't even paid to do this kind of work. And I will tell you, like the first thing I did when I started Hope and Heal Fund, I got in my car, or rental car, or train, or plane, and I just went to communities. And communities said to me, thank you. And I said, well, there's no grant yet. They said, thank you for showing up. And I said, what do you mean by that? And they're like, no one visits us. They said, you got in the car, you drove to San Bernardino, or you drove to Pomona, or you drove somewhere else, and you showed up, and you asked us what we need, as opposed to the bus tour, the philanthropic bus tours that everybody does, or they're, the program officers behind a desk. So we're doing it a very, very different way. And I think, hopefully, and sometime soon we'll see a lot more because we're seeing the numbers go up in gun violence, but I think our approach is going to work. So one of the things that we do is bottom up. And I just talked about that. Bottom up means truly, really putting community first in a very racially equitable way. And I also think too, just because we're talking about public health, this is a public health approach, right? So, and it's also an intersectional approach, right? You can't cordon off street violence from domestic violence from suicide. I'm starting to see the movement really look at those three issues and start really looking to see how to address them, but you can't silo them. I still see a lot of siloing, like here's this person, they're doing firearm suicide, this person's dealing with DV and guns, this person's dealing with community violence and guns. You can't do that, right? As we talked about from the data we see, like one of the biggest problems are guns in the home. Something like 60% to 2/3 of all mass shooters, public mass shootings, get their guns from the home. Suicides, typically half of all California gun deaths are suicides. Those are guns in the home. Domestic violence, lethal domestic violence, guns in the home. So if you read the media, you would think that this is all about street violence or gangs. It is not. It is not at all, right? And so I think we really have to really do a better job, all of us, in being really intersectional. And I think really what drives us at Hope and Heal Fund is our framework. Our framework is prevention, intervention, trauma healing, and aftercare, right? We've talked a little bit about that, some of the speakers before. The cost of gun violence, like we were talking about, what does it cost per injury, per death? What's it costing taxpayers? And also to bring in the gun equation is we have to cut off the easy access of guns to our children and our teenagers. I was at a high school in Stockton, Edison High School, and I asked a group of young people, I said, I know this sounds like a really dumb question, but how long would it take you to get a gun and come back here? And they said, a couple people, young people raised their hands and said 5 minutes. That's how easy it is to get a gun. And they're not all gang members, right? That is something that the media portrays. Sometimes young people feel like they have to arm themselves because they're just walking to school. So we have a lot of work to do. But the framework that we have set up, I think, is something that really speaks to the comprehensive approach that Hope and Heal does and the really intersectional approach that Hope and Heal does. So we talked about bottom up. I also want to talk about, so I don't want to say top down because that sounds awful, but systems approach, right? When I first started, our chief equity officer said, we're going to do a systems approach. I was like, I have no idea what you're talking about. And basically, the way we boil it down for a lot of folks is a lot of counties have institutionalized plans for battling wildfire, homelessness, earthquakes, right? Why aren't they tackling gun violence, right? Why is there not an institutionalized plan in every county to tackle gun violence the way we attack other things, right? The way we do that. So I think without, and happy to talk about this more in the Q&A, but we've got to really look at changing systems so that systems address gun violence. We cannot wait for the mass shooting where we throw everything at it. Who's there after a firearm suicide with a young child that finds his father killed? Who's there after, folks dying in ones and twos in different parts of California? We've really got to do a better job of looking at this not just as a public health issue, but also as like emergency operations plan, institutionalizing plans that year after year gets funded so that we can address gun violence in terms of prevention, intervention, trauma healing and aftercare, and cutting off the easy access of guns. So I know I got to wrap, but the one thing I will say is it's also about data, data, data. Like a lot of communities don't have their hands on a lot of data. We are working to try to train people to do their own GIS mapping for data, right? To own their own data, to get their own data from their localities and get the data so it's down to for community violence, community homicides, down to the street level, right? Down to the community level, so they can better strategically target their solutions. So I know there's much more to talk about. I'm looking forward to the Q&A, and thank you, Dr. Erskine, for allowing me to speak. Appreciate it.
I'm going to invite the panelists up now for the Q&A session. I have a couple questions that I'm going to ask them, and I encourage you to think of your own questions, and then we'll send a microphone around so that you can ask them. Okay. So, panelists, you talked about the importance of involving community members, involving those people who are impacted. And on the one hand, I think I love that idea. On the other hand, are we asking people to relive trauma and to do the work that wasn't their problem in the first place? And I really thank Joshua for speaking and for sharing, but is that what we are asking people to do? Oh, wait a minute. I didn't give you a microphone.
So other than the fact that I voluntarily tell my story, for the very first time about 2 months ago, I was asked what the state could have done differently or what they should be focusing on. And I knew exactly where you're going when you started this question, because am I asked to relive the trauma? Absolutely. But is that something that then I have this moral dilemma of, is this something I should continue to do? Should I relive my trauma so that somebody else doesn't have to, right? And so that's ultimately where I come from. And while it may be triggering and it may be extremely difficult to do so, it's something that I feel is a duty, and something that I think, how can you really shape these programs, and kind of what Brian was getting at the beginning, how can you form policies and how can you form treatment plans and all of these different things without taking into account the individuals who are affected?
I think that's a really important question. We have to make sure that we're engaging survivors in a respectful and a meaningful way, and we're not tokenizing our survivors. We hear so many times from our community partners, you're doing another needs assessment. We've been assessed so many times. You take my knowledge, you get a PhD out of it, and we don't get any funding, we don't see any programs. So we have to be very mindful of how we're using community time. Another thing I think we learned early on in our community engagement, we come in there with our public health slides and our theorems and our diagrams, and they know it because they live it. What we do is we commodify that local knowledge and we package it and make it inaccessible. So I think that's something we need to look at, how we shift our systems and how we recognize where that knowledge really exists.
Yeah, and I want to pick up on that point too, is when you go deep into the community, they're already doing this work. I mean, so it's not like, hey, can you guys like step up to the plate? They've already stepped up to the plate. And I would say a lot of philanthropy and a lot of folks just don't know who they are. They may not even be paid. They may not be paying themselves to do this work. But once you find out who they are, you're very inspired by what they do. And so while it's an important question, they're already down that road, right? We're just, what we try to do at Hope and Heal Fund is try to expose them to other strategies. Like if folks in Oakland, California, or LA County are doing good stuff, let's share it with San Diego. Let's share it with San Bernardino. Let's share it across impacted communities. That's not being done. So what we try to do is add value to that. But these folks are already in the trenches.
So you talked about an institutional approach. You talked about, talking to people in different communities. We talked about different kinds of violence. Are there things that we've learned that are more universally transferable or more successful when we think about some of these strategies around prevention?
Well, I will say a lot of folks are now starting to read a lot about what some folks call community violence intervention or violence interrupters. I think it's been really fantastic where if for folks who aren't aware of what that really means is those who have been a victim of gun violence, may have even shot somebody or been shot themselves, may have been incarcerated, come out, and part of their rehabilitation is to reach out to young people that look like them and really go literally into the neighborhoods and with a lot of possible active shooters to try to mitigate the problem and try to convince them that there's a better way, there's another way. And so that's really promising. But I also think too that we can't just leave it at intervention. That's what seems to be really working well in a lot of different communities. But what about prevention, right? What about youth leadership, right? What about young people who grow up, in areas where you may not have ever been shot, but you around violence all day? Like we need to make sure that folks don't get to the point where they want to pick up a gun, and then we need to make sure that there's aftercare and trauma and healing for all of that.
Yeah, I would agree the peer approaches are so important. I think it cuts across strategies, even with suicide prevention, access to means, things like having gun violence and domestic violence restraining orders puts some power into family members, friends to help when someone is at risk of harming themselves or others and help to build that social fabric to prevent violence.
So the first question I missed was about community. What was your
About involving people who may be reliving the trauma that they were initially part of.
Okay, I'll try to thread that with the second question. I think in any kind of data production, knowledge production process that will inform policies and interventions, it has to be centered by community. And as Brian said, a lot of times it's not that we're there to say, here are some ideas, it's actually generated by the community. And then kind of threading to the civic engagement. Again, I'm not a gun violence prevention researcher, but I'm a public health professional. I care a lot about racial equity, and I care a lot about community engagement. And the data I showed that was just a report card, but we actually have data on civic engagement among youth. We have data of can you speak up in a forum. So we have data on social cohesion in a neighborhood. So I think it gets at the backstory of the power grid of trying to motivate people in community engagement and knowing how to use the data to ask for specific monies for interventions and policies.
There are a lot of people that talk about, the fact that many guns that are used to commit crimes are purchased in other states, and so things that happen at the state level or at the local level, can't really impact outcomes in that jurisdiction. And I'm wondering what you think about sort of our national approach to this on a state by state basis and on a locality by locality basis, and whether there's anything, given that it's unlikely that we're going to change that tonight, that we might be able to think about.
I'll start off with clearly what we're doing isn't working, right? So like we are finding ourselves in a society where there are more guns than there are people in the United States. And we are, as was mentioned, one of the most affected countries in the world by gun violence. So what we're doing is not working. We're not going to solve it tonight, but there needs to be a better way to, I can get on a soapbox about just limiting access to firearms completely, because that's ultimately, in my opinion, the best way to solve this issue. But in my case, I was shot by a firearm that was purchased in another state. He not only stole firearms from his parents, he stole money from his parents to purchase additional firearms while he was on parole in the state of Washington. So there's multiple steps there that were already wrong. He was on parole. He purchased firearms while on parole. He was a known domestic abuser. He had been arrested. He was a known member of the Aryan Nation and a known neo-Nazi. He was the head of security for the Aryan Nation, which was well known at the time. And he was still able to purchase a firearm, cross state lines, all while on parole. So there was very clearly a disconnect from not only law enforcement and government, but just and a lack of execution on what they should have been doing during that time. I'm happy to say that the state of Washington has since made some incredible changes, but until we really look at the issue at hand with what is causing it, in my opinion, are two main things, and that's A, the mentality that we have around firearms and gun violence, and that is not how do we prevent it, it's what do we do after it happens, right? So we need to be looking at how to prevent it from the get-go. And the second part of it is just getting rid of the number of firearms that are accessible. We've all mirrored the same statistic and the same understanding that firearms are very easily accessible to children, teenagers, adults, which turn a half thought out idea into something that they can execute extremely quickly and easily, whether that's a suicide, mass shooting, or homicide. Everything escalates when the presence of a firearm is there. So ultimately, in my opinion, that's the only way to solve this problem is to get rid of what's actually causing it. You can't have a car accident without cars, right? So.
Yeah, it is interesting about where the guns flow from, and certainly there has been an uptick over the years in guns coming from Nevada and Arizona into California, which are far easier to buy. That said, it is really important. So about around 70% of all guns that are traced to crime in California were first purchased in California. So we still have a lot of work to do. And this gets back to the gun access piece. Like, so if guns are showing up in South Central LA, where are they coming from? LAPD knows, but are they sharing that? Not right now. I'm not trying to be hard on LAPD, but they're not sharing that. The public and the community has a right to know where these guns are coming from. The good news is a piece of legislation was passed, which by July 1st of next year, all jurisdictions must report all their traced guns to California DOJ. And then Cal DOJ must release a report soon thereafter that shows by jurisdiction where the guns are coming from, right? So it's really important to know, like, if you're in LA, which I've heard rumors, like the guns are coming from gun stores, are first purchased in Pasadena and Glendale. That's kind of good information to know because they're not coming from, in this case, it's not Nevada or Arizona's problem. I hear a lot of people talking about that. Yeah, it's a problem, but the problem's here in our state. And we need to have the data. Again, it goes back to the data. We need data to form solutions. And if we don't have the data, it's hard to solve the gun access piece.
I want to invite the audience to ask some questions. So there will be a microphone around. If you have a question, please raise your hand, and Courtney will come find you. I can't see. Oh, right up here in the front, Courtney. This gentleman in the green jacket.
It's green. Okay. First of all, my name is Gary, and I'm a retired teacher, so therefore I'm a realist. I've been in the trenches, you know. And I first of all want to congratulate each of you for your wonderful efforts. I mean, that truly are admirable. However, as you can read any newspaper or magazine, suicides and homicides are increasing significantly. I don't know all the solutions, and I'm not sure that there are solutions, but whatever's being tried, like Josh said, maybe saves some lives, but overall it's not working.
One of the things I will say on that is that one of the massive changes that I've seen personally, especially as we do see homicides and suicides continue to increase, and we're having an all-new discussion about mental health in general. That was something that, you know, some of the programs that are being looked at and some of the programs that are being implemented in an attempt to curb not only gun violence, but suicide in general and violence in general, is taking a look at where we are as a society. I'm sure, I don't know the numbers off the top of my head, but I'm sure if you look at the numbers, the number of people who are depressed or have anxiety or all these different disorders, that are coming from a very high stress environment that we now live in, you're going to, as we begin to open up the conversation about those things, begin to normalize and destigmatize going to therapy, you're going to start to see some change there. But, as I said, for the first time, I got a call 2 months ago to actually have that discussion. So it's finally a discussion that's being had, and it's something that we can look at. And I'll end it with this, because this actually is a very large pet peeve of mine. There are not a lot of actual mental disorders that can be completely blamed for violence, right? So I very often hear mental health as the number one reason why a mass shooter did what they did, and it's just not the case. But with that being said, mental health is something that we do need to look at in this country and the world in general. There's a lot of great innovation happening, and it's just kind of a matter of time, but it's only one small piece of the puzzle.
I agree with you. It is disheartening to look at the data and to see that we're still dealing with these issues. And I think with the discussion around mental health, there tends to be a stigmatization where we're blaming people who have mental health issues for violence, and that's simply not true. We need to find ways to heal our relationships with each other. That's really the root of all of the violence that we see. And some of that's driven by our systems. It's driven by investing more in incarceration and policing than it is in school, in arts and culture and programming that youth and families need.
I'm going to push back a little bit on you. Yeah, no, I think part of the problem, and I could speak to this firsthand, is I think when people think of gun violence prevention historically, they think of gun laws. Pass more gun laws, pass more gun laws, what's going on in the state, what's going on, federally. And gun laws are important, but they're not the whole solution. And I think that our entire movement for many years, ever since the Brady Bill was signed, was like, let's keep doing this. This is the magic wand. There is no magic wand. It's a piece of the puzzle. It is a tool in the tool belt. We have to utilize all these other tools. And I will say, right, that these community violence interruption, these violence interrupters that are, these strategies have been employed in different parts of California across the country prior to COVID were very successful. Like murders, gun homicides in Oakland dropped. Gun homicides in Stockton dropped dramatically. Well, yeah, so two things happened over COVID. Huge gun surge. And those violence interrupters weren't able to do their work. They turned into handing out PPE, right? So now they're getting back to it. So the one thing is a lot of these strategies for its prevention, intervention, trauma healing, and aftercare haven't really had a chance. And nor do they get the press attention that they're working. They, trust me, they do work. And that's where communities, cities, counties need to invest in these programs, like they're investing with the Office of Violence Prevention in LA County. That happens, then we've got the whole tool belt working. It's just been one tool we've been focusing on for like the past 30 years. Now we have more tools in the tool belt, and they do work.
So mental health in terms of suicide ideation and severe psychological distress, as measured by Kessler-6, is up, particularly for young adults. And it's not knowing like the causation, we're not dealing with that, but having, if a person is in severe psychological distress or is thinking about suicide and has a plan, then has a gun in the home that's loaded and unlocked. So that's what, that's the kind of pattern that we want to see. Who are, who are these people? Where do they live? What kinds of interventions can we get at? So I think that that's how we can try to address that.
Yes, gentleman in the center.
Hi, my name is Stuart. I'm a retired academic pediatrician. You haven't talked, I know, about younger children. You started with adolescents, but actually I and several colleagues and other people around the country have looked at younger children, and it's a very disturbing factor that the most rapidly rising cause of death in younger children, even under 5, is guns and gun-related death. Primarily more suicide, but some accidental deaths as well, but not the same reasons so much as you see in older adults. And so I have two questions. One is, what has been the experience in California in terms of children, and what kind of trends have you seen in California with pediatric gun deaths? And secondly, you all talk about data, and there's a lot of data out there. I just looking at the children's data, I can tell you there's a lot of data out there. Yet I don't see that data presented nationally in the most effective way, because some of it is so obvious that it's really hard for people to avoid coming to the conclusions about the issue of gun ownership and safety and all this. Could you make some comments about that? Do you think we're really presenting the data in the most effective way, or should we be doing a better job? I'm sure you've had a lot of experience with this issue. Thanks.
I'm going to give it to Brian, but I can say that 2021 just was the first time that we had these questions, because for the longest time, we could not put questions on gun and gun safety. And there was just no source. The government, no, there was no source. So this was actually this was like a revolutionary time for us to put these questions. So we're just seeing some of these patterns now. I can't talk about nationally, and this is what I'm going to hand the mic to Brian on what he's seeing nationally.
Yeah. So data. I think the way data is presented, I really appreciate you talking about that because, there's CDC data that comes out. That's a problem. There's a big lag time. There's the homicide report put out by California DOJ every year. And with that report, I have to go through each table to try to figure out what I'm trying to get. So to your point, that is an example. Like, I'm trying to find out how many domestic violence related gun deaths occurred. It's hard. And we're actually talking to California DOJ right now about how can we get information presented in a way that is useful to researchers, to advocates, and community-based organizations. Right now, it's not. I take it upon myself at Open Youth because I love digging through data, but it's really hard. I would also say the other problem with the data, and this would go to the homicide report also, mostly to CDC, is not only is there a lag time on this data, which by the time you get it, it's almost, these days is almost useless, but a lot of it only goes down to the county level. Like LA County, I don't have to tell Kelly or all of you, 1 out of every 4 Californians or whatever it is lives here. Like if we have LA County data, like that's bigger than most states. Like that's not that helpful, right? So the way the lag time, the way it's aggregated, and I would also say from a racial equity standpoint, like it's not presented in a way that is useful to a lot of impacted communities. It's just not. And so there is so much more to do. And one of the things we're trying to do while we're doing the systems approach and the bottom-up approach, we're also working with research institutions and others to really push them to get information that's really useful to the rest of us, not just with each other, not from one researcher to another, but like a community-based organization, right? And that goes back to the point is one of the projects we have is we want to train local residents, pay them for their time to learn how to do mapping, to gather their own data, to do a Freedom of Information Act if they have to get the data so they can do it in real time. So it's useful data to them so they can map it out. So the data piece is just, yes, there's a lot of data out there, but I really appreciate that question because it is a quagmire trying to make sense out of some of this stuff. So thank you.
I would add to communications and how we portray the data and how to portray it in plain language that's really going to be impactful. I think that's very, very difficult to do. It's difficult when you're immersed in the data to see how it can impact people and working with media to get them to report on these things and to make it an issue.
And a final part of that is, unfortunately, data, especially very accurate data, isn't particularly sexy. Right? So that is not what the news reports on, unfortunately. And what is reported on is something that is such a splash that it's questioned as to why it is so extreme in one direction or another, right? And so we're now living, unfortunately, in a world where the data that is powerful when you look at it is not pulling the same weight that it used to because everyone looks at data and says, well, who funded it? And they think that the data is all being skewed one direction or another to hit a political point. So unfortunately, I think until we can get not only the media to look at data from a strictly fact-based perspective, we as a society have to reevaluate how we take a look at all of the information that is thrown at us. As a millennial who's spent most of my life with the existence of social media, there is no There's nothing stopping you from throwing whatever number, whatever statistic, whatever theory you have on social media, and all it takes is a click, and somebody has passed that along, and now you have tens of thousands, if not hundreds of thousands of people believing that something you just made up in your bedroom is fact. So we have to replace the value of data, and when we talk about it, when we look at it, we have to make it so that there is no questioning, right? I'm not a researcher. I don't want to be a researcher because that's a very hard task, but we have to look at it in a way that there is no question. And unfortunately, there are so many people out there right now trying to find inconsistencies and trying to find a problem and a motivation behind the data that is presented. And until we can squash that, I don't see how we can present data in a way that is meaningful and impactful until we can achieve that.
So data is not sexy. I think it really is very sexy, but also I think you need stories. You need stories that are just so compelling and powerful to be paired with the data. And it's something very specific. I talked about the data starting from adolescence. I think older adolescents to 18 and older, and you can subset to the 18 to 25s. CHIS is a household survey, so among the adults that have associated minor children at home, we can then estimate the number of households with children that own a gun and the safety procedures. Also, it's people have come to me and say, CHIS is great, but I can only see the county level, and what's happening is my neighborhood. If that was the case, then we would have to, blow up CHIS so much, it'd be even more expensive than it is, and I'd be out doing bake sales more, like I'm right now. So what we do is something called small area estimation, where we take the real data, survey what people tell us, and then we pull several years and put in some other added data, auxiliary data, and we have a tool called Ask CHIS Neighborhood Edition, so you can look at your zip code and your census tract level, or your place, or your congressional district, or your state senate and assembly member district, and look at some key patterns. We just collected 2021 data, but stay tuned. We are going to start putting at the Ask CHIS Neighborhood Edition at the as low as the track level on some of these estimates that I was showing you today.
One last comment, because I think it got overlooked when you said it. Researchers have not been able to ask these questions for a very long time. Yes. And it's not until extremely recently that on not only a federal level, but on a state level as well, that researchers were even given the opportunity to ask these questions. And so we have to look at this epidemic as just getting started in terms of understanding how widespread it really is and how much it affects our society, because we're only just getting started with the ability to ask these questions. I'm not going to go down that road. Brian knows I can go down that road for a long time if we talk about those pieces of legislation. But it's really important to understand that we're just now getting our hands on the really important information.
And I'll make a plug for Ask CHIS and Ask CHIS Neighborhood. As far as data sources go, it's very user-friendly. So I would encourage all of you to pop in and ask the questions that you're curious about.
I believe the word you were looking for is sexy.
I don't know that I'm going to go. Ask CHIS doesn't make my top 10 list of things that are sexy. But any other questions?
Hi. So unlike Joshua, I actually am a researcher, or hope to be a researcher one day in public health, perhaps gun violence, perhaps in some other field. And what I'm sort of interested is in this field called causal inference, and I think maybe I can't really see your nameplate from here, but as someone who is an academic, maybe you have colleagues who are interested in causal inference, or just broadly, determining causes from public health and gun violence. And my question is simply, what sort of research is being done currently to assess certain risk factors, specifically not just correlations or statistical relationships, but specifically the causes of gun violence?
Yeah, that was a very sexy question. That was a causal inference, right? So, so stay tuned. So we are doing some research now. The list of colleagues I put on one of my slides will be presenting some of this in the 1212 E.R. Brown symposium. And I think the causal inference is so important. I actually refrained from doing crosstabs or just correlations of, say, gun ownership and feeling safe in your neighborhood, for example, because which way does it go? And if it shows that if you own a gun, you feel the most safe in a neighborhood, what does that mean? Like, okay, everyone should get a gun so they can feel safe in the neighborhood. So it's really like this ecological fallacy and not getting at other factors that are that have to be considered at the same time. So I think that is one of the the big issues in this research, but also to be as objective as possible. As in all, as what the research enterprise expects us to do, but this is just so heated and so compelling, and we have to do something. So researchers just have to be very careful about the way that they approach associations, that it's not just an association, really understanding that there might be other, I'm going to use the word confound, there might be other things going on in the background that's not measured. And there might also be some kind of like reverse causality going on or simultaneity. But anyway, this is like what this investment in national, the gun violence, NCGVR, that's why it's a research grant. It's to really get, the best and the brightest thinkers about this, both from the contextual, those who are content experts, but also modelers that make sure that the causal association is really well established.
Thank you.
Hi, everyone. My name is Ellis. I'm actually an undergraduate student at the UCLA school. I'm an education major, but I work with Dr. Katona, who is an epidemiologist, and I do a lot of gun violence research, and I have been doing it for kind of a while now. And I had just had a question for the panelists. I don't know if this is kind of a hefty question, but I did want to bring it up. I know you guys were talking about research, and I think you guys were kind of alluding to the Dickey Amendment, which is the amendment that pretty much denied all research because they said that it's whatever, violating our second right, all that kind of stuff. But my research professor asked me, honestly, even if the Dickey Amendment is banned pretty much and we are allowed to do all this research, and I don't know, you guys are all doing that, which is so amazing, but still the NRA has so much power. And I saw this one article that said they pretty much think all this research is tainted. So what do you guys think will be a way for us to kind of still show that this research is true and like valid, and what, like, I know you guys kind of mentioned that it has to be like the community stories that has to be partnered with all that research in order to really kind of wow and like show that this is such an important topic. But I guess I just wanted to ask you guys, how can we like fight against like such a big power in our world? Yeah.
There's a lot to unpack in terms of, and there's a lot of different things that go into what we can do, right? But I think the biggest thing that I'll hit on there is that the NRA is not as powerful as they used to be, and they're continuously losing a lot of that power. And I think that's because a lot of the work that all of us are doing, not only the four of us up here, everyone in this room, even by partaking in this conversation, you're already working against what they want, which is for you to remain uninformed about the issue of gun violence, right? You look at what their mission was when they started that organization, and they are very far from it now. Didn't they file bankruptcy? Yes. Yeah. They filed for bankruptcy, probably a financial move, but that's a whole nother story. But with that, they're losing the ground that they once had. And to your other point, that they're basically saying that all the research is tainted, and that's kind of what I was getting at before. In a world where every time we present numbers, everyone is looking at it, trying to figure out who skewed that data in one direction or another, right? It's like all the old stuff that cigarettes were good for you because they funded their own research to tell a story that they wanted to tell. And ultimately, we have to find a way to present that data where there's no question, right? There is no disputing the facts. And we also have to get back to having civil discourse amongst each other where we can take a look at this data and actually talk about what's going on, what we're seeing in the numbers in the community, and understand that you can disagree with somebody without like swearing them off for the rest of your life. But we have to remain open-minded. And that goes both ways. It's on both sides of the aisle. It's on both sides of the argument in terms of gun violence. We have to continue to remain open-minded, and until we are able to do that, we're not going to see research looked at in an unbiased way.
I would add campaign finance reform. We shouldn't be able to have these powerful lobbies by our politicians and determine what our laws are.
And thank you for that question. I think because the Dickey Amendment, which was 1996, which prevented federal funding of a lot of research, the bar door is open now, right? Philanthropy, like Ninez, you're from philanthropy, you're Stefan Chis to do, so I do feel like it's a whole new day. But to your point about kind of marrying stories with research is really important, and I would just tell anybody who wants to kind of dig in a little bit more, we're doing immediate, I know you guys are working on media narrative change, and we are too. We have for 5 years. And I invite you to go to our website and look at Berkeley Media Studies Group, who was one of our grantees, did in 2018, a look at how gun violence is portrayed across domestic violence, suicide, and community violence in the media, in the print media. And it is probably just about what you think. But the important part of that is now we've gone to credible messengers across all three of those forms of gun violence, collected messages. We just tested them. We just got our results back. And now we're going to go back to those communities with the messages that resonate. And it's really important because what we're trying to do with this project is also show that gun violence is preventable, not inevitable, right? And we want local communities to be able to lift up their own stories. And we're trying to we're taking the language from them, we test it, we spit it back out to them. And we're really trying to do that. But it's really important not just to tell the story, but to your point, is to marry it with the research. Because research alone, as sexy as it is not as sexy as a really amazing story from the community. So I think that marrying those two things together is another, it's like a longer term project that we're working on.
I mean, that's been my role. I met Brian 15 years ago at the Brady campaign, and that has been my role for all that time. I'm not an academic. I'm your average Joe. I was shot at summer camp when I was 6 years old, right? And when I was 10, 12, 13 years old, and I walked into a politician's office, or I walked into a reporter's, editing room, or sat down in front of a camera, people listened because I was a young kid speaking passionately about a topic that most adults were afraid to talk about. And, I've now told my story probably 1,000 times, and I don't have that same pull that I did when I first started as a child. Now I'm just some adult. But and it almost comes back to the initial question of re-traumatizing survivors time and time again. And where do you have this moral dilemma of like, where do you draw the line of one person's suffering to help the community at large? And that's always where I've been and where I come at this topic, because you have to have a powerful story. And I haven't minded being a poster child for gun violence because it's what needed to happen. I was able to sit down with people, and people who would normally see, the name of the organization on my name tag, which I haven't even talked about, but like they see my name tag that says Women Against Gun Violence. First of all, I wasn't a woman, so like, why are we listening to you? But second of all, normally they wouldn't even have a conversation, but now a young kid came and sat down and spoke passionately about something that affected their lives, and they can't not respond to that, right? So you draw this line, and there's no way about it, or there's no way around it. I mean, somebody is going to have to suffer in order to provide progress, and whether that's suffering in retelling my story or suffering in watching another person get shot, I have to make that decision every day, and that's where I come from when I accept the opportunity to speak somewhere, or when I work with an organization. That's what goes through my head. Is this going to be hard for me? Yeah. But is it worth it if I could maybe prevent it from happening to one other person?
And I think that's a great place to end tonight's forum.
Can I bring it up? Like, do we have to end on the down?
No, that you brought it up.
Go back to data.
Yeah.
We'll show some charts and graphs.
There we go.
I really want to thank our panelists, Brian, Kelly, Josh, Ninez. Thank you so much for coming. Thank you for coming. At one point, we had over 100 people on our live stream, so thank you, live stream people. And I think that we've all made a first step. For some of us, this is something that you're already passionate about. For some of us, it's something that maybe it's going to be a new passion of ours. But I really think that that this is an important conversation, and I'm so glad that we were able to have it tonight. I want to just say a word about Paul Torrens, and Paul Torrens believed that these kinds of conversations about these kinds of important issues that touch, all across public health, all across the contexts that we all operate in, are really what makes a great public university a great public university. And so if you can, I would encourage you to make a donation to the Paul Torrens Health Forum so that we can continue to offer this free for community members. And I will make a plug for our next health forum, which will be on November 30th. And on November 30th, we're going to have a discussion about the impact of the Dobbs decision on women's reproductive health in California. So thank you again for coming. Thank you for your attention and your questions, and have a great evening. Also, because the forum is free, I'm going to ask you to return your name tags. They're very fancy name tags with the magnet on them, and we'd love to be able to reuse them. So, Courtney, maybe you can stand near the back and people can give her name tags.
Did somebody leave their green bag out?